Thank you all for coming. Tim McKee was to be moderator today, and his wife had an accident. I think they're not able to come, so I'll just step in. The presenters are myself, although I will be stepping aside for a newly arrived gift from the gods who showed up on the candidate cafe, who happens to know what he's talking about. We'll introduce him in a bit. Also, Jim Becklund, who is co-chair of the Forming Elders Caucus, and Mary Sanders, who was another member of the caucus. They both have a substantial bit of information. I think a lot of people think, oh yeah, you get to this age and you get these programs and there's all this stuff, and then you find out what it really is like. Oh my gosh. So the purpose of the caucus, basically, before we introduce, we want to start with a question poll. 3-question poll to learn a little bit about our audience. And I guess I'm not sure quite how this works. The way it was set up was to, maybe we'll just do shows of hands. You can type in yes, one for yes, and no for no. Seeking some information as to how that might work best for people. Do you want to just do hand raise? Do you know how to do that, or try to type in something? Do we have the poll option, Cynthia?
I'm not sure this has that.
Okay, in that case, let's just do a quick show of hands, and this is more just like an FYI to get people thinking about issues. But so if you just raise your hands or use the hand raise function, and I'll go through yes or no. How many of you here are 60 or older?
Keep going.
Yeah. So I'm not able to count that easily. If somebody wants to do that counting, they can. I see 8. I would estimate about 16 or more here. I'm not seeing, they're not counting how many people are here. So say about 16. How many are not? How many are younger than 60? Nobody's saying anything, but I think maybe one. But yeah, I know some are younger than 60 here, but 34, 35. Okay, good. Yeah, our youth contingent here. How many have senior family members you worry about? Or maybe the senior family members who might need special care or who have health issues. About 9. Okay. How many of you work with seniors in a professional capacity? Just a couple. Not surprising. So basically, yeah, we can try to share later on, and I don't think this was set up to do the kind of polls that we wanted to do, Miriam. I'm sorry about that, but we got a good, most people here, I think, are 60 or older, but there's, I would say a good third of the contingent are younger than 60. A good chunk have family members that they're older or worried about or have health issues, and then a couple work in a professional capacity. So to introduce our panel, Jim Becklund, who is from Michigan, will talk about, and I'll let him talk about several things that he's covering. But then Mary Sanders from Hartford, Connecticut will be speaking mainly about food insecurity. And then I and the new guy, Christopher and I gotta find his name, Christopher W. Vanderwalla. Now he's laughing. Okay, well, so anyway, we'll be talking about Medicare, on traditional Medicare and managed care plans and what a mess it is. And I do have some stuff to present, but what happened is that one of the candidate cafes, Chris had showed up, and during an off chat they were griping about Medicare. And so I said, please come, because Chris knows an awful lot about this. Anyway, so only one person works for seniors. Okay, so Jim, briefly introduce yourself, tell us what you have to share. And by the way, if anyone has questions for the panelists, please put them in the chat. We'll answer as many as we can later in the program. Jackie, would you be, this is written into the script. I didn't make this up. Jackie, would you be willing to monitor the chat and write down any questions so we can try to answer them later? Will that work for you? She's been a behind the scenes person and publisher of a one-page daily photos and inspiration, by the way, from, and now this, if anyone is interested. Jackie, can you take those notes? I can kind of keep looking at them too, but.
Yeah, that's something that I couldn't do. I told that before that wouldn't be something that I could do. I'm sorry.
Okay. Well, what we'll try to do is just make sure I'll try to get them and others can try to help out too. And actually, if the room host could help out, that would be helpful. So that way we will have, if people want to ask questions, I believe the thing is we're going to have presentation, Jim, and then we'll have Mary's presentation and then mine and Chris's, and then we'll have time for questions and answers, hopefully. So Jim Becklund, why don't you take it away and let the room host know if you have something to share and if you want to be on speaker view. Oh, Diana Brown, thank you. Keep the chat questions. Okay. Jim Becklund, go ahead. Brief introduction. Go ahead and do your presentation.
Thank you, Holly. Good afternoon, fellow Greens. I am Jim Becklund, co-chair of the forming Green Party Elders Caucus. Today, we're going to be spending some time talking about issues facing all of us, and especially how these issues affect the elders community in the United States. Can everyone hear me okay? Okay, sometimes my microphone doesn't work quite right. But anyway, who are the elders? We are people near or in retirement age, that is 60 years old or older. We have lived a full life, worked hard, and saved for the years when we can sit back and enjoy a comfortable lifestyle without worrying about anything but enjoying ourselves, our family, and our friends. These are commonly called the golden years. We have hoped that Social Security and the savings we have put aside would give us a comfortable lifestyle. In one of the richest countries of the world, everyone, and elders especially, are suffering through an affordable housing crisis, ever-expanding healthcare costs, and an ever-increasing inflation-driven cost of living. Whether it is the soaring cost of housing, ever-increasing grocery bills, or the ridiculous increase in the prices of gas at the pump, or for home use, elders across the country are feeling their Social Security and savings drained more and more each day. No one should have the choice between paying for medication, mortgage or rent, and putting food on the table. The latest Social Security adjustment for cost of living was 5.9%. Yet inflation has risen a whopping 9.1%. Let's look at three of the most pressing issues. First, housing and the ever-expanding gap between how much elders have and how much they must pay for housing. The average cost of buying a home is $383,000 in 2020. Today, it is much harder to afford the cost of purchasing and maintaining a home than most elders can afford with their retirement savings and Social Security. Although the average mortgage payment varies, the average payment is $1,600 per month. We must not forget that there are 44.1 million renters, which 9% or 3.9 million are those 65 years or older. Although renting is less expensive than owning, the average rental fee is still $1,216 per month for a one-bedroom apartment. One demographic we tend to overlook is the mobile home ownership. Although a person may own the mobile home outright, they still must pay rent on the plot of land underneath it. As of February 2022, there are 3.2 million elders living in mobile home parks. Since the beginning of the pandemic, park rentals have doubled or even tripled. One example is 75-year-old Virginia Rubio, who has lived in a trailer park in Forks, Washington for nearly 30 years. For years, the rental on the property teetered around $350. Now it is shooting up to $1,000. What does a retired elder on a fixed income do to make the math work? People like Virginia are trapped in an almost impossible situation. It seems very unusual that renting has increased by 13.5% and inflation only 7% in 2021. Big corporations now own most of the rental property. We all know how zealous they are about their profit margin. The lack of affordable housing, thanks to the big corporations, has kept the low to middle income people in a constant state of serfdom. The system is rigged against the tenants to the point that housing is not a human right, but a commodity. Elders on a fixed income are ones who find themselves caught between a rock and a hard place. Next, we look at healthcare. We must all agree that access to healthcare is a human right. For most elders over 65 years old or the disabled, Medicare is the main source of healthcare. It wasn't until July 30th, 1965, that then President Lyndon Johnson signed into law the creation of Medicare and Medicaid, which now covers 60.6 million Americans. Basically, Medicare consists of three parts. Part A, paid for by the government, covers inpatient hospital stays, care in skilled nursing facilities, hospice care, and some home health care. Part B, paid by you, automatically deducted from Social Security, covers doctor's visits, outpatient care, preventive care, and medical equipment. Part C, paid by you, covers the remaining 20%. Parts A and B don't cover. Cost varies by plan, the individual chooses. There's also Part D, which covers prescription drug and varies in cost depending on the plans chosen. Let's briefly look at Medicare Part B premium costs. Part B premium costs have risen an average of 7.7% per year since 1996. The premium for 2022 is $170.10 per month. Part C premium depends on what plan you choose, but may run well over $200 per month. For elders on a fixed income, Medicare is very important to offset the ever-increasing medical treatment costs, among them just a simple stay in the hospital costing $13,600 per day. Lastly, let's look at the cost of living. Remember here that the average Social Security payment as of March 2022 is $1,536.94 per month. The average cost of living for a single person is $3,189 per month. For a family of four, it is $7,095 per month. We've already looked at the cost of homeowning and renting and the cost of healthcare. There are many other expenses elders face throughout the year. Home and renters insurance rates have gone up as much as $100 per month. Predictably enough, many insurance companies are moving out of state because of their high expenditures on claims due to climate change. Yes, climate change, no longer viewed as just an environmental issue. It threatens public health, the economy, and our future. Food prices have risen at a shocking rate since the start of the pandemic and the supply shortage associated with it. The average cost of food in the United States is $355.50 per month per person. The cost runs from $183 in Manchester, New Hampshire to a whopping $556.76 in Honolulu, Hawaii. This is where elders must make some tough decisions. Do I feed my stomach, or do I take the medications that keep me healthy or alive? Another thing that affects the cost of living are utility bills. These are only some of the things that we must pay each month. Think also of clothing, entertainment, and pets, to name just a few things. Looking at all these expenses, one wonders how elders can survive. Thankfully, there are subsidy programs for rent and food pantries offering food to the hungry. They make it a little easier. Unfortunately, elders are left out of the tax breaks that working families with kids get. We still have rent or mortgage payments to pay, groceries to buy, and utilities to pay. One last thing that is disturbing is poverty and homelessness in one of the richest countries of the world. As corporations and individuals gather billions of dollars for themselves, we have right here in this country a group often referred to as the invisible people. As corporations and these 37 million Americans who live below the poverty line, that is about 11% of the population. How shameful is it? Corporate greed and how the wealthy elite suck up every dollar they can, taking advantage of an economic system they help to build to benefit themselves. While the elite get richer, 4.9 million elders live below the poverty level. Official U.S. poverty guidelines are one-person household, $13,590. Remember, the average Social Security payment is $1,536.94 per month. Poverty has a side effect. You see it on the streets and parks of major cities. You see it under freeway overpasses, makeshift shelters and tents put up by the homeless. Of the 74.6 million elders in 2017, 33.8%, or 25,214,800, are either living in these tent cities, their own vehicles, or are in already overcrowded shelters. We have a serious problem of the most vulnerable people, the elders, who in their younger years have helped make this country thrive and are now living a deplorable lifestyle that should and can be fixed. At this point, very little has been done to help cure the problem. Elders in need are often ignored or treated much like garbage that can be picked up and shoveled aside. Thank you.
Thank you, Jim. Some good statistics and a lot to work in, of course. What I want to do is here, we were going to have questions and answers at the end. Mary has a slide deck. She's on the phone, and I've asked her to send it to me so I can share the screen and use her slide deck, because it's more, obviously we want that to be used. But I'm wondering, there are a few comments I'd like to share, and then if there are a couple comments that Jim could answer to. David Strand mentioned median, I imagine, is lower than average. Do you have those figures? You were talking about average figures, and the median sometimes is a different thing. Did that crop up in your research?
Yes, I looked at both the median and the average seems to fit more than the median is. That's why I went with the average prices. I didn't want to spend a lot of time explaining the difference between median and average, which would add more time than probably would be necessary. Don't want to bore people, basically. So I went with the average first.
David, did that answer your question? If you can't speak, you just note in the chat or something. Wanted to mention a couple other comments. Christopher pointed out part
Yeah,
of
that I was just going to say that does more or less address my concern. It's just most often, particularly when you're talking about any type of financial issue, the median is lower than the average, and the median would be what most people actually receive.
Mhm, mhm. Thank you. So I'm looking for Mary. Mary, if you can send me those, send me that slide deck and I will.
Yeah, I just sent them.
Okay,
I
okay,
just sent them out.
okay. Oh my gosh, okay, so now I have to,
Excuse me just for a second. I
Yeah.
want to address Christopher's
I was just gonna say
comment in the
right
chat.
ahead. Yeah, please go right ahead. I was gonna say that next because I'm getting, yeah.
Yeah, I agree, Christopher, that my overview of Medicare was very basic, and it didn't really, might not jive, but I know Mary is going to be addressing it more accurately and in more detail than I did. So yeah, I do apologize for the little bit of confusion.
No, I just wanted to add it in for clarification for anybody who may not know.
Thank you.
Oh, shoot. I'm trying to download several of these at once here. Okay, I think I've got them all. And so be forewarned, Mary, you may have to tell me to find a different, I'm not sure they're going to be in order, but I'll do the best I can with this.
Yeah, I think they're numbered.
Not the ones I saw. Wait, let me try another thing here. I think I can do it this way.
Anyway, the first slide doesn't come in until a few minutes
Okay.
from now.
Okay. Actually, I think I can, well, that's not gonna be great. Okay, so why don't you, what you do is cue me and I will share the screen.
Yeah.
So, yeah. I just want to mention too, Carice Cordero mentioned the dreaded donut hole for meds. That was another, yeah, surprise people got. So what I want to do now is we can go back to and ask questions after this is done. So thank you for your patience. So, so the next panelist is Mary Sanders. Please introduce yourself and then just let me know when you want me to screen share.
Thank you, Holly. Yeah, so we're kind of regrouping. Like it was mentioned earlier, Tim was supposed to be our moderator, so I'm appreciative of Holly for stepping up in that role. My name is Mary Sanders. I am from Hartford, Connecticut, and I have been an official member of the Green Party since 2016, when there was a big movement online called Dem Exit for the people who were disappointed with what was happening with Bernie Sanders. A bunch of us who were officially registered as Democrats switched our party affiliation and posted our new registration cards all over Facebook and Twitter to let the Dems know that we bid them adieu. So since then, I've run for office a few times. I've run for state rep, I've run for city council, and I have just been asked to run for Congressional District 1 against our 22-year incumbent here in Connecticut, John Larson. So the nominating meeting is next week, but they told me I could pretty much start campaigning. So I'm happy to do that this year. My topic is, what I wanted to speak about is hunger, because I worked at a food pantry for 17 years at my last employment, and from which I was laid off just a couple years shy of retirement. So that kind of threw me into an early retirement and put me on the other side of the aisle as far as a person who for 30 years offered services to the community at different nonprofits. I was now probably qualifying for services and needing services, because even though I had jobs that were paying in the mid 40s to high 40s, as soon as I stopped work, my income dropped to $16,000 a year. And now with the cost of living increases, it's gone up to about $18,000, $19,000 a year. So when it was just mentioned that the average cost of living is over $3,000 for a single person monthly. I'm like, well, I'm making do with at least a third less, because to supplement my Social Security, I'm also doing a little tutoring. I tutor Spanish, and so I can bring in a couple $100s a month to supplement my income. So I've long been involved in different types of activism around social justice issues, including police accountability, racism, affordable housing, the environment. I was part of Occupy Hartford with the whole Occupy Wall Street movement. And I've been around for a little while. Most recently, I've been working heavily on peace issues, organizing petitions and trying to meet with legislators here in Connecticut. You know, Connecticut, the big weapons manufacturer. So trying to get them to retool the machines and think about sustainable industries and getting away from that war economy that we're also hooked into. So I received numerous mailings during the month, and one thing I received lately was from Bread for the World, and they talk about global hunger surges in the summer 2022 publication. And their president, Eugene Chow, says, "We are responding to the surge for hunger here in the United States, as well as around the world. With rising food prices, more and more households are struggling to get enough to eat. Food banks report growing lines of people waiting for essential food. And Bread for the World, Catholic Relief Services, state food banks, and other numerous charitable organizations have been urging Congress to expand access to nutritional programs, both here in the States and in other countries." Reverend Cho added, "This is the most severe hunger crisis in the century." And according to a fact sheet that they had, they said the federal food insecurity data released a few months before the pandemic indicated that more than 11% of US households, many of these with children, many of these with seniors, were food insecure at some point during the year and did not know where their next meals were coming from. I received a mailing from the And Together Foundation, which is an organization that helps people lift people up out of poverty, and got the information for slide number 1, Holly, if you can
Okay.
put that up.
Okay, yes, I think I can do that. So, there's screen, okay, hang on.
And it just talks about some of the reasons for poverty, and the reasons are as diverse as the people facing it. Now, I'm not going to read everything that's here, but you just call your attention to the different line categories, if you can see that on your screen.
Can I butt in one thing? I believe these slides are going to be made available afterwards. Am I correct? You can send them in, and if anybody wanted all the details, I can get them.
They have already been posted on along with the workshop Zoom links.
Okay.
I noticed that when I looked earlier that the people already had access to the slides, so some of you, may have already downloaded them. But they're talking about things like chronic unemployment, which includes some people that may be overqualified for jobs that are being offered as seniors after many years of working, in professional positions. So all of a sudden they're out of work and they have to readjust, like I had to, or for others, poverty is all they've known all their lives. Addiction and trauma is another category. Debt, which I'm sure a lot of us seniors know about, especially medical debt. Family breakdown. And when people talk about family breakdown, or there's a lot of emphasis on single parent households, but there's not I don't hear a lot of discussion about seniors who all of a sudden are alone as a one-person household, where they had 2 incomes for so long and their spouse either leaves or dies, unfortunately, and then the person who's left behind has to take care of all the expenses and get used to living with only 1 income. And then, of course, educational failure, people who hadn't had enough educational opportunities or training opportunities. And then they pose the questions, how would your life be altered if you were affected by any of these categories? And then I added the question, how many of these do you think cause poverty for people over the age of 60? And I had requested that people, type that into the chat, but we're not gonna take the time to do that because I think we're already running a few minutes behind. So maybe we can talk about that later. People have different concepts of what causes poverty across different age groups. When I was doing research for this presentation, I accessed a report from Feeding America, and they talk about the state of hunger in 2020, which sheds light on the extent of food insecurity for seniors age 60 and older in the United States during the first year of the COVID pandemic, and continues to show how food insecurity affects seniors differently based on demographic and socioeconomic characteristics, as well as geography. For seniors, obtaining adequate nutrition can be especially important to support healthy aging, but can also be challenging due to some limited financial resources, declining health, and mobility. So what causes food insecurity? Food insecurity is a complex issue that usually doesn't have one particular cause. Food insecurity that seniors face are due to different factors that make it also difficult to access the resources that are available to meet their basic needs. That includes poverty resulting from living on a fixed income. And like we said, for some, this is all they've ever known. For others, it comes later in life after retirement, death of a spouse, or other loss of income. Food insecurity rates are significantly higher for adults with incomes less than 2 times the poverty line. Some other factors include social isolation, chronic or acute health conditions, high healthcare expenses, lack of affordable housing, systemic racism, and racial discrimination. Holly, can you put up slide 2? Is that it? Okay.
Mhm.
So slide 2, I'm not going to read all of this to you. You can look at it in your own time, but I just wanted to look at the trends graphic at the bottom of the page for a minute, so that you can see how food insecurity has fluctuated slightly through the years, but has been on a steady rise. And recently has been higher than even during the time of the Great Recession. So there you can see the trend there. In a nation known for its wealth, too many older adults don't have enough food to eat. Roughly 5.2 million older Americans faced food insecurity in 2019, before the pandemic hit, and even more so after. When the COVID pandemic hit, many older adults were not able to access food or were food insecure. This was the result of factors like income loss, fear of leaving the house, lack of help with grocery shopping and transportation. For some, it was a scary but temporary situation. For many others, sadly, it's their normal. But what does food insecurity mean? I looked up the definition with the Department of Agriculture, and food insecurity is defined as a household level economic and social condition of limited or uncertain access to adequate food. In simple terms, food insecure older adults can't rely on getting enough food to lead a healthy and active life. When older adults are at higher risk for food insecurity, they're certainly not alone. More than 38 million Americans of all ages were food insecure in 2020. The Department of Agriculture defines 2 degrees of food insecurity. Low food insecurity refers to people who lack dietary quality and variety and may not be able to buy all the foods they enjoy and need. However, they don't necessarily eat less than they need, just have to make different choices. For example, an older adult with low food security might depend on some inexpensive and unhealthy food items and eat these foods repeatedly. Their diet may be heavy in unhealthy processed foods versus nutrient-dense foods that cost more, such as fruits and vegetables. And the other category is very low food security. If a senior is experiencing very low food security, they eat less than they need nutritionally. They regularly skip meals or eat very small portions to stretch their budget further. What's the difference between food insecurity and hunger? Food insecurity isn't the same thing as hunger. While food insecurity focuses on lacking access to adequate food, hunger is a physiological condition. Someone who is hungry doesn't just experience a rumbling tummy. They might suffer from serious discomfort, pain, weakness, even illness due to being involuntarily without food for an extended period. Although food insecurity and hunger are not interchangeable terms, they are closely related. Older adults with very low food security often face the real risk of going hungry or eating foods that are not nutritional. Now we'll look a little bit at the demographics with slide number 3. It probably wouldn't surprise you to know that households of color are more likely to experience poverty and food insecurity. Food insecurity has negative effects for individuals across the age spectrum. I know that the information on the slide is quite small, but you'll have it after, and you can look at it adequately. But additionally, some seniors experience food insecurity at higher rates, including seniors who are identified as Black, Latino, Native American, have lower incomes, are younger, which surprised me. The age group 60 to 69 is the most affected senior group. Those that have a disability and those that are renters. And so if you add up all those, if a person happens to fall into multiple of those categories, their rates of food insecurity are going to be much higher. As a matter of fact, the food insecurity raises to over 20% for those between the ages of 60 to 70, and then drops a few percentage points between ages 70 to 80, and decreases even further after that. So that was a surprise to me when I got this report. I just thought all seniors were experiencing food insecurity, but it happens to be that 60 to 69-year-old group that is most affected. So we have to kind of figure out why, people are accessing programs later. Are more people going into assisted living situations where they don't have to worry about their own grocery shopping? This decline may be due to more aging populations accessing programs like Meals on Wheels, or, like I said, living in assisted living situations. All right, so let's take a look at which states are most affected. On slide number 4, we see the geography of senior hunger. So even though some states are doing better than others, all are affected by one or more of the 7 measures of health, income, and opportunities that are highly correlated with food insecurity. The hungriest states, the terminology they used in the report, the hungriest states include Alabama, Arkansas, Kansas, Kentucky, Louisiana, Mississippi, New Mexico, Ohio, Oklahoma, Texas, and West Virginia. Food insecurity rates varied considerably by state, from 7.8% in New Hampshire to 16.8% in New Mexico. So which seniors are the most affected? Just to sum it up a little bit with slide number 5. In a new United States Department of Agriculture report indicated that African Americans have not made progress in food insecurity in the past 2 years like some other groups have made. And that food insecurity has not fallen below a pre-Great Recession level. Food insecurity among African American households is nearly double the national rate and triple the rate of white households. In addition, food insecurity among Latino households is double the rate of white households. The senior population is growing. Most of us in our 60s are looking forward to or already trying to enjoy our retirement. Instead, many of us are struggling because of food insecurity. Seniors make up almost 13% of the United States population, and the number of those seniors living below the poverty line is close to 4 million. Is this how we want to treat our beloved parents, grandparents, and elders, and what should be their golden years? The number of seniors experiencing hunger increased dramatically in the past 10 years. If this trend continues, seniors who are hungry will increase by 50% by the year 2025. In 2040, there will be 79 million seniors in the United States, baby boomers who are retiring and aging. This generation has the potential for many among us to be going hungry and not meeting their needs. Now we'll look at the impact on people's health with slide number 6. Food insecurity impacts on senior health. Food insecurity among seniors age 60 or older in the United States has a negative impact on their nutrition and health. Poor health can be both a cause and consequence of food insecurity for seniors. I don't know if there's a way to post that instead of horizontally, to put it vertically so they can see those numbers or not. Anyway, for example, disability and disease contribute to employment instability and income challenges. Additionally, inadequate nutrition can increase the negative effects of disabilities and chronic health conditions. You can see some of the percentages. I was really surprised with those percentages. I didn't realize it was that high. National Health and Nutritional Examination Survey that was conducted provided information about food insecurity and its health and nutrition implications for seniors. Findings showed that food insecure seniors consume lower quantities of key nutrients such as iron and calcium compared to seniors who are food secure. In addition, among the senior population, food insecurity is associated with an increased risk of developing negative health consequences such as depression and asthma. So it affects mental health as well as physical health. Food insecurity is associated with worse nutrition and health outcomes for seniors regardless of race, ethnicity, age, gender, education, and marital status. But obviously, if people have, fall into some of those categories we mentioned earlier, it's going to be have much more of an effect on them, because traditionally a lot of these groups are underserved as far as getting health care, as far as living in an apartment that is safe. For example, I'm in a 6-family brick building. It's very hot in my apartment, and we're all trying to survive here. And it's Hartford. Well, obviously that's the capital city, and I'm not in a residential area. So they say it's usually hotter here than it is, in residential areas. That's another topic we might talk about in the future, how the heat is affecting us all. So seniors have unique nutritional needs, and not having enough wholesome food to eat can create harmful health effects. Food insecurity has been linked to lower nutrient intakes. Older adults with food insecurity consume less key nutrients such as protein, vitamin A and C, magnesium, calcium, and iron, and these can lead to malnutrition, vitamin deficiency, and chronic disease. Seniors who are food insecure are 65% more likely to be diabetic. They're more likely to suffer from conditions such as congestive heart failure, high blood pressure, asthma, obesity, and gum disease. A lot of people don't make that link between obesity and food insecurity, because you see a person who's overweight and you assume they're eating enough. The fact of the matter is they're eating unhealthy choices that put that weight on. And these poor outcomes are not just the result of the poor nutrition. Often older adults with food insecurity choose between buying food and visiting their doctor and paying for medications. So it's all related. The constant worry and uncertainty associated with being food insecure can also take toll on a person's psychological well-being. One of the studies showed a clear connection between food insecurity and depression. And the same study demonstrated that food insecure households were at the highest risk for stress and anxiety. I attended a workshop the other day on mental health and food insecurity, and although that's not in my presentation, which was already prepared, they stated that people who have these mental health conditions and are experiencing food insecurity are less likely to seek the resources they need because of their depression and anxiety. They won't go to a food pantry. They won't go sign up for SNAP. And I know I'm running over my time, so I'm going to try to wrap this up. There are a variety of programs to help support seniors as they age, and many of them included, are specifically designed to provide nutritional assistance. The SNAP program, Supplemental Nutrition Assistance Program, formerly known as food stamps, continues to be the first line of defense. And there are other programs, the Commodity Supplemental Program, the Emergency TFAB Program, Child and Adult Care Food Program, but a lot of these are hard to access. When I first lost my job, I did sign up for one of the Commodities program, and I was very disheartened to learn that in the whole city of Hartford, there is one distribution site, which is on the opposite side of Hartford. That cost me $15 or $18 to get to in an Uber, which really kind of made it not worthwhile to go pick up the box of commodities that they were passing out, unfortunately. Since I started tutoring on the side, I have not been in such a dire need, but I know what it is like to be there. Then we have one final slide, and that is about the SNAP program. If you are having trouble affording healthy food, if you know of an adult that is in need of help, there is help available. One of the most common solutions to food insecurity is the United States Supplemental Nutrition Program, SNAP, which is needs-based and helps eligible adults buy the food they need to stay nourished. I believe there's around a $200 a month allotment for one single person. And of course, it's a sliding scale, it's based on your income. So a lot of people who are eligible for SNAP, but are told that they're only eligible maybe for $30 or $40 a month, they don't want to bother signing up for it because it is a lot of paperwork, constant paperwork, because people have to go through this renewal cycle every 3 to 6 months. So there is information there, and you can check these programs out. In addition to SNAP, there's the Senior Food Box Program, the Senior Farmers Market Program, and the Emergency Food Assistance Program, which is usually administered through the food pantries and also at some senior sites. So check your eligibility, and when you're ready, and there's a confidential screening tool, at benefits checkup link there that's in the on the handout, and see if you qualify. If you do, it could be life-changing. It could mean a couple $100 a month in food for you. And I hope I have not gone over my time too much. If you have any specific questions, I'd be happy to engage with you. Put your question in the chat. And I think that's it.
Thank you, Mary. Really good statistics, and a number of. It's interesting that I've seen in the chat a number of complaints about food banks and services going down. In my city, actually, is possible to get. There's a need, and it's a problem is the need and the amount, but the service is actually good. There are a couple of places where you can get free meals and seconds and that stuff. But more and more people are having to rely on that. And I can tell you, for 30 or 40 bucks for SNAP, that can go a long way if you're buying potatoes and broccoli and onions and stuff. But I wanted to comment just before we go on. You mentioned this, the strangeness about the 60 to 69 demographic as opposed to older. I bet I know what the issue is, because I've noticed this too. It's not just your age group or generation, but it's where you fit. And then among the boomer generation, the older ones, there were not that many people around. There was a lot more stuff available especially at that time, in this country. And as the younger half of that came up, all the time I was in school, it was always overcrowded. There was too much. We had huge classes. They hadn't prepared for how many people. So it was the most underemployed generation or part of a generation. But there was also a big backlash against consumerism and materialism, so nobody really cared. You could always get a job at the post office and live. So, you know, you didn't have that to deal with. But I do think it's important to realize in certain parts of a demographic, you may have some significant differences. So we have some comments here in the chat we could look at, or if there are any questions here that people would like to ask Mary. Otherwise, I'll touch a couple points and then I'll get to my part of the presentation here. Any questions offhand for Mary?
I think we had a poll question actually after this about, you know, how many people
Okay. All right.
worried about food, or either themselves or somebody they care for, somebody in their family.
Yeah. How many of you have either personally or know someone who's had struggled to have adequate, healthy food every day? Raise your hands if you are food insecure, or let's see, raise your hands if you need help yourself, or you know somebody who needs to be. Let's see here. Maybe about a third of the people here. I know there's more than that because I know that some of you have stuff, but anyway, also want to mention one other thing here, a couple of things. In some places, they're not telling people about services or food stamps. It is a lot of paperwork, but yeah, you do have to kind of be a footbill sometimes and ask about services and what is there. You know, I just happened to find a brochure, you know, at one point. It wasn't, in this case, it was just oversight. But, you know, sometimes as Cynthia mentioned, sometimes they don't, she said they don't understand, they don't advertise it on purpose. They won't let seniors know, which is too bad, because sometimes those are the ones least able to get any other means of support. Personal needs items, another one. I see Diana had mentioned all seniors are eligible for the Affordable Connectivity Program for a free cell phone and or tablet. You must use a cell phone at least once a month to continue. That's one good, yeah, thanks for letting people know there. And I think also mentioned that they weren't eligible for SNAP in California until a year ago. I don't know what they were doing. Cannibalism, perhaps, I don't know. So if there's nothing else, I'll go ahead and present what I had here, which involves a visual aid. And this is only about a third of the size of what, oh, you can't see it, too bad. Well, you can just kind of get an idea of what is going on here. Here's all the choices you have for Medicare programs you can take. Ta-da, 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 ta-da. Let me see, there's at least, there are hundreds, possibly thousands, and all kinds of addresses and all kinds of information, but some of it not what you really need to know. And even the people, and in my town, I think they were sincere, but they didn't have all the details either. It was absolutely ridiculous. Let's see. Oh, one other thing, Christopher says they're likely, you know, the 1950 program. You can talk about that in a bit. But I did want to mention a couple things about Medicare. So I was on briefly because I lost my job. My department was cut, and because you're over 40, forget it. Even if you have relational skills during a recession, there's nothing. So I was lucky to get a part-time job, but I didn't have a lot, and I was on state Medicaid for a while. When I became eligible for Medicare, or for Social Security, even though I can't take it yet, it would be stupid for me to take it because I lose quite a bit. And I was in kind of a weird situation. So I wanted to not take it right away, but you're still considered to have this income, even though it barely covers the cost of your Medicare Part B. So was lucky to have savings. I paid for Medicare Part B. And I also paid for another supplement. Now, Jim mentioned Part C, and I'm not even sure what that is, but there are a couple things I wanted to mention about this. Let's see, where's my Medicare? Okay, so there are several. There's Medicare Part A, which is basic, that's covered, and that's covered for everybody unless you make more than a certain amount, then you pay something. Medicare Part B, there's premiums for outpatient care. CHIP program pays for very low income. If you have any Social Security, you don't qualify, and it will be taken from your Social Security check, whether you like it or not. Automatically deducted unless if you're not getting Social Security, you pay for it. Now that covers certain things, but there is a deductible. Part C, I'm not sure if was the blanket to cover everything else. Part D is prescription drugs, which you are going to need probably. So you take that, and that depends on who's selling it. It depends on what state you're in and what drugs you have. But that you also pay in addition. Then there are parts F and G. I strongly recommend, even though they cost more, you should try to get on Part G. Part F is no longer available, but Part G is overage. Oh yeah, it doesn't pay for everything. There's overage. So, you know, fine, but then you may be stuck with more of a bill. So Part G covers that overage. It's very important to have that. Part F, which I got in by having a birthday about a week before the deadline, they dropped it, but that also covers the deductible. But you want to ask about the overage, honest to God, and then even with that, because somebody didn't program something correctly in the electronic record, there are certain things that, at least one cat parasite that for the test for which is not covered. So you might have to pay out of pocket. So there are these things that you think, oh, well, yeah, Medicare, great, everything will be covered, or, you know, or maybe you can pay a bit of a premium, but no, that's not it. So there's that, but I wanted to just share before I get to Chris Vanderwall, because he had a lot more information than I did. But thanks to Jackie Devino, there's this guy called The Lever, Russell Brand, who's kind of a loudmouth in a good way, and he has a video called "If This Isn't Corruption, What Is?" He noted the costs for Medicare. Joe Biden announced the highest Medicare premium hikes in history, and he complained there could be no lower payments due to legal and operational hurdles, which is basically the corporations having everybody over a barrel. Does funneling profits to private insurers, the same insurers who donate millions to the presidential election campaign, have anything to do with it? Donations to Congress members' campaigns from private insurance during the 2020 Biden campaign, $4.7 million, which isn't all that much actually when you consider them. But no, that's what they paid into the campaign. Since taking office, they've expanded involuntary REACH programs and continue to promote the Advantage programs, which I'll mention in a moment. Your money, all of us are paying taxes. Elders are paying more, but we're also paying taxes, and everybody's paying taxes into Medicare premiums. The Advantage plans are contracting with private insurers, and some of the supplements also through private insurers. So they're funneling public money to private insurers. Basically, we're paying taxes to these companies. Let's see. It's never spelled out, including the senior services counseling. They may or may not push Advantage plans, mainly because of lower cost. Advantage plans cost a lot lower to start with. And they do offer some things like glasses, prescription glasses, which are not covered by Medicare, and some dental plans, which are also not covered by Medicare. The problem is they can cut you out. They might not cover everything, and you might be left out, and it will be harder and more expensive to get into one of the other programs once they cut you out. It also raises the taxpayer in general cost because everybody has to support that. So they said 8.5% hike in payments to private Advantage plans insurers next year. United Healthcare, CVS, Aetna, Anthem. One of the things they are notorious for, they inflate by making people look sicker than they are, but then they deny them care. Now, I know people have Advantage plans that work well. And so some people are lucky, but you do need to be aware of it. Those things, they're not bound by some of the federal chains that the other supplements are. So they can change when they want. Also, depending on where you are in the country, if you're from West Virginia, too bad, because everybody there has black lung, whether you have it or not, you're still affected by those premiums, and you're going to pay more than anybody else. Advantages have to pay profits to investors, something that we here understand. So we're paying profits to investors, unlike traditional federal Medicare, where these Advantage plans do have an incentive to limit care. I wanted to mention, let me see, a couple other things here. According to the Journal of American Medical Association, nearly half of all new brand name prescription drugs launched in 2020 to 2021, more than half of those will cost about $150,000. From 2008 to 2021, the launch prices for new drugs increased exponentially by 20% per year. Originally from 2008 to 2021, drug prices would be $2,115. That's 2115. By 2021, they were $180,000 and $7, $180,007 a year. That's the increase in prescription drug prices, astronomical. So again, for traditional Medicare, plus you'd have to get you buy some of that, then you buy prescription drugs and then anything else to ensure what is there. I did make I called it racketeering. I also mentioned, people talk about socialism and compare this with the socialist countries where they do have some kind of, and it's never all, people always gripe about everything, but we have our platform talks about pension reform and talks about the need to detach from utter profit motive annuities and such, because there's some danger in that. So I mentioned, well, as far as socialism goes, this doesn't look like any socialism I can think of, except a very well-known one where they might have figured that, we were just useless eaters and they can grind us up and eat us. But National Socialism, I think, is what this looks more like, if we know what that is. So that's, sorry, that's a bit discombobulated. I was actually not planning to do anything for this and didn't want to, except, Starling says, unless you have nothing. If you don't have money, if you're under a certain level, you can get help to pay for Medicaid. You can get that help. But the thing is, if you have any teeny tiny thing at all, you don't get that. It's not like Medicaid. There's nothing. So you really are kind of over a barrel. But I did want to introduce this in our candidate cafe, and I will just mention, please look on the Eventi board and you'll see more of these. There's going to be one tonight and then tomorrow night and Sunday morning. They've been going nicely, I think. But Christopher M. Vanderwall showed up and is more of an expert on this. Well, I shouldn't say more of it. I said an expert on this stuff. And I'd like you to talk a little bit about what you were talking about and add to what I say or correct things or what you think would be important for people to know. Because this is one of these treacherous things. People go, oh, gee, I got the wrong program. Oh, duh, you're screwed, Yeah. Anyway, go ahead.
Well, and it's also to discuss, from my experience, the elder industrial complex in terms of care, because this is something that is not typically discussed and known by a lot of people. And it is basically the warehousing effect that has been going on. And I went through it with my parents, particularly my mom, and watching so many people trapped in these facilities who were in many cases forced into them, because DHS or somebody else labeled them as being dementia or something else, and as opposed to trying to help them have in-home care and things like that so that they can still maintain their life to some degree. One person I met was actually Canadian, and they were forcibly trapped in the facility my mom was at. It is horrific, and it is not something that is typically covered. Another point to mention is that when it comes to Medicare specifically, I know, at least on the mental health side, that many don't want to cover it. And the only way, like say in Oregon, for example, when you go into a specific facility, so for example, if it's Good Samaritan, or sorry, if it's a Legacy, or if it's Providence, or if it's a Seventh-day Adventist or one of the others, you'll have to join their particular form of Medicare if you want to receive treatment. And part of that is because Medicare normally has codes that they can based on like what medical issues you have. And so the billing is very, consistent and universal. There's laws that specifically focus on that. And if you have anybody or anybody that has a knowledge of that, like I have a friend who specifically works along with her mom at a hospital, working on doing those codes and working with the insurance and things like that. And Medicare is actually quite consistent. The problem is that the amount that's paid is not the amount that a lot of professionals want to be receiving pay-wise, and there are other factors. So a lot of folks aren't, which is why we also have this very large mental health problem where folks who get older are really trapped. And this is especially bad for folks who have, for example, things like PTSD and depression, and when folks get isolated. Another thing that I had mentioned previously, and I think Holly was, sorry, did you have a question?
I will. Finish. I have a
By
question.
the way,
Oh,
folks,
okay.
we have only a few more minutes, so maybe about 5 or 7 minutes. So
Okay.
sorry we went on too long, but yeah, this is actually extremely helpful. So thank you.
Okay, yeah, and I'll quick try to finish up. So what I think Holly was having me talk, wanting me to talk about additionally is in terms of family planning and other settings, when you are dealing with family, I know in my case and many others, folks are having to live together, kids are not able to leave the home. You've got these desperate living situations like I was with my parents. And one of the problems is that if you need Medicaid, for any, there is an underlying problem, which is that if you take those benefits, it unfortunately in most cases not really charity or an assistance program like we think it should be. In fact, it's more like a loan, because if you die, and the state have specific regulations and that enable you to say like inherit your house or something. The parent will their assets will basically be, say there's still a loan on the house, the bank will get the first run of it, and then the rest will go to whatever was owed or due to Medicaid, for example, and kids be damned. So unless you plan everything out. Another to note is when it comes to Social Security, if folks don't have preset medical plans in place, Social Example will not accept a durable power of attorney. So you have to have the specific paperwork through them. Everything has to be incredibly detailed and documented. And if you don't have every little thing done, you'll end up in a situation like I did where they will effectively tell you that you can't do anything. And now if the person is cognizant enough to be able to help and be able to fill out paperwork and give those kinds of verifications, it's good. But ultimately, from my experience, the bureaucracy there is seeking to punish, less assist. I don't think necessarily the folks on the baseline are trying to do that, but it is fundamentally a problem. We're probably close on time.
Yeah.
Holly, I don't know if there's an opportunity at a different point for doing some kind of event like this to try to help folks have more information. I'd be
We've
more
already
than willing
talked
to
about
assist in
it.
that.
I was already saying, because I was kind of panicking. I was hoping to have someone more of an expert and do this. And I think one of the things our group would like to do is sponsor something, because this is one of these landmine things, and you really see up front as you don't really see beforehand just how vicious. I said National Socialism. Who the hell gets? It's like you read that book about the cockroach guy, Kafka. It's like, what the heck? Who came up with this crap? So I think it would be good. And what I'd like to do is, we have your information, I know, but if anybody's interested, please put your name now or email in the chat room. If you put in the chat room, we can follow up if people are interested in this kind of, I think we also know who has joined this. And so we can follow up if we want to do another, because I think there would definitely be an interest in much more of a guided tour of all this mess.
And if anybody has any questions for me specifically, I will leave my contact information in the chat to if you folks want to reach out to me. Oops.
Thank you. Yeah, and I think I think we can get the
Jackie's
Jackie, I heard you. I'm going to ask a moment, but we're running out of time otherwise. Yeah, sorry. Yeah, no, I was going to call on Ely. This would be about the last chance we have. So Ely, if you can ask, I think we're almost out of time, but go ahead, Ely. Ely Arden.
Did you call on me?
Yes, Ely, go ahead.
Yeah, I can confirm everything that I said here because of my monthly meetings of the elder group, Somerville, Cambridge Elder Group. The thing that is not mentioned here is that this is an industry. The AARP is exploiting the older population to do a brainwashing job, telling them that they can no longer participate in running for office because then they will stop being a lobby. That's one form of exploitation. The most common form of exploitation, however, is elderly housing in Cambridge, which isolates the elderly from the general population. That is one of the psychologically one of the most stupid, destructive things that can be done. It is reflected within the party and the behavior of younger people coming into the party, and it's present in several chapters. People like the person who talked me into joining the caucus, Herlihy, she was the one who talked me into joining it as a safe place to speak. She stopped going to meetings because of the prejudice. Other people just stopped going to meetings of their chapters because of the concealed dismissiveness. This affected leaders of the party like Mel King, whose status was very high. As soon as he got to a certain age, people stopped paying attention to anything he said. He was one of the most brilliant strategists and remains that. That's it.
Thank you. Yeah, gets to be I think, as mentioned, Ilya is our most senior, I think, almost making the century mark. So that's, I do see one more thing. Lisa Taylor asked, can you suggest alternatives to AARP? I can't. I almost joined them because they were cheaper, Plan F.
Yeah, no, I don't know of anything. I could help you if you wanted an alternative to the NRA. If you wanted a socialist rifle association, but I cannot unfortunately help you with an alternative to AARP. I don't know if one exists, but I would suggest looking in your local area and checking to see. And maybe as a suggestion, maybe that's something we as Greens need to look at, particularly as part of the Elder Caucus, since there is a lot of issues that folks do not have access to, and information is spread and incredibly scarce. So I think that's something we need to actually talk about and work towards within this community.
Well, thank you very much. I'm really glad that you stopped in, and I'll just mention the Candidate Cafe again because I'm shamelessly plugging it. Thank you very much, and thank you, Jim and Mary, for really excellent work in statistics, which are always a shock to a lot of people. We're about ready to leave.
Holly, can I just say one quick thing?
No, it's got to be quick.
Yeah, that John Rensenbrink would be here with us today. He's the other elder at 94, but he's sadly in the hospital right now.
Oh yeah, we don't want to forget him too. That's one of the founding members. So anyway, I just want to thank everybody for Jim and Mary and Dee Taylor and Jackie and others on the caucus who worked hard on this and helped out. It's time to start wrapping up. We can get out of here in time. Thanking the panelists. I'd like to also thank the annual meeting committee, Dee Taylor and Tama Yeager, for inviting us to participate. Thanks everybody for coming in here, spending your afternoon with what was kind of probably a boring and uninteresting kind of topic, but something you just have to deal with. So, and if you're, what is it, 60 is the cutoff age? If you're older, we can come and join our caucus. I think is it elders@gp.org. What is the?
It's in the chat.
Okay, it's in the chat. Okay, so you can go ahead and apply to join. And thank you. And so thanks. I hope you enjoy the rest of the annual meeting. And thank you for joining us. And thank you, Cynthia, for hosting the room.
Thank you all for helping us out.
Thank you.
See everybody in the
everyone.
next
Good
panel
night.
coming
Take
up
care.
here in a minute.
Thank you, Christopher.
That'd be great.